everyone. Good morning and good afternoon. My name is Jennifer Ho, and I am the Deputy Director of APCASO. We are a regional network of civil society and organizations on health, human rights, and social justice in Asia and the Pacific. With me today is Peter Wiessner from Action Against AIDS, Germany, and together we'll be co-moderating this first session titled COVID-19 Communities in Action and Where Do We Go from Here? Peter, would you like to say a quick hello before we proceed?
Yes, of course. So my name is Peter Wiessner. Thanks to Rachel for the nice music. We started already dancing here. So we are really excited to have this session together with you. It was completely organized by Gfan Asia Pacific, and we are really grateful that this can take place. I am the only, no, not the only, but I'm a European, as you could see. So we are looking forward to a discussion. I hand over now to Jennifer, and I work for Action Against AIDS, so we were the organizers together with some partners of the whole conference. So thanks so much for being with us.
Thanks, Peter, and you'll be hearing more from Peter later as well. Also with us today is Shonna Shonning, who will be repertorying for our session today. Shonna, will you please switch on your video and say a quick hello as well?
Hi, everyone. It's an honor to be with us. I'll try to capture your ideas as well as I can.
And Shonna is a long-term friend of us, so I'm really excited to have you with us, Shonna. So thanks so much for being with us.
Great, thanks. So to get us started, and I really want to try to get all of us keep on time, a few housekeeping issues. If you missed the opening session right before this session. So please note that interpretation is available. Please do go to the bottom of your Zoom function and look for the interpretation icon and select the language of your choice. Show you need interpretation support. And please also try to utilize the Q&A function for your questions instead of the regular chat box. We would like to capture your questions accordingly, so please do leave your questions in the Q&A box, and we'll be monitoring the Q&A as we go through the session later. Our session today is hosted by Global Fund Advocates Network in Asia and the Pacific, also known as Gfan AP, together with partners and Peter's organization as well. And it's meant to highlight the impact of COVID-19 on Global Fund programs, communities, key and vulnerable populations, health and community systems from the perspective of communities and civil society in Asia and the Pacific, as well as the community responses in dealing with this unprecedented health crisis with the support of the Global Fund. So we're really glad that you're able to join us today. In addition, our session will elaborate on the urgency for equitable access to COVID-19 tools in the Asia Pacific region and the upcoming 7th replenishment for the Global Fund hosted by the United States next year in 2022. Our speakers will be making their recommendations on the roles of donors, including Germany, and the implementers in achieving universal health coverage and in ending HIV, TB, and malaria as epidemics in our region, the Asia Pacific region, by 2030. And I think it's important to contextualize all this discussion in the context of the G20 presidencies being held by countries in our region, with Indonesia in 2022 and India in 2023, and the G7 presidency to be held by Japan next year. Oh, no, next year, I'm skipping a year ahead, in 2023 as well. So to help us kick off today's session, I would like to invite Rachel Oanh, the regional coordinator of Gfan AP, who's also been leading the organizing of today's session, for a few welcome remarks. Rachel, the floor is yours.
Thank you. I will be very brief because the floor should be with our speakers. We have so much to hear from them, as well as from our participants that are in the attendees section and can't actually really talk to each other. So thank you so much for being here. I hope everyone is keeping safe, and I think more importantly, sane. It's been 18 months, I think, since the last of us actually saw some of each other, physically. So it's been a long road, and I hope that we get to see each other at some point in 2022. A very thoughtful World AIDS Day to many of you, activists, fighters, colleagues, friends, and many of you family, for doing the work that you're doing, for keeping the fight that you're doing. And thank you all for the work that you've been working on despite the challenges of COVID-19. So I won't go on much further, but I want to thank the co-organizers for giving us the space to highlight the concerns from the key populations of this region, as well as to highlight what else needs to happen in other parts of the world, because we don't want to leave anyone behind. I want to also thank my colleagues, Niluka and also Anu, as well as the translators, just in case I don't get a chance to say closing remarks later, because I do hope that we'll have a very, very engaged discussion afterwards. So thank you again to the speakers for agreeing without any hesitation to present in this discussion. Thank you. Over and back to you.
Great. Thank you so much, Rachel. So now, without further ado, let us get started with today's session, and let us move into the experience sharing and reflection part of our discussion today. Just briefly, we'll start out with 3 short presentations, followed by a panel discussion. We hope that all the presenters and speakers will try to keep to time so that we can have a full 15 minutes toward the end of our session for Q&A, and that we can also close on time. Again, you can please leave your questions and comments in the Q&A function of the Zoom, and we would also kindly request the speakers to also please look at those questions and provide responses if possible throughout the session. Please note that this session is scheduled for 95 minutes. And so first off, we have invited 3 speakers to join us and to share with us the civil society perspective and experience, including responses on COVID-19 and its impact on our progress towards ending HIV and AIDS in Asia and the Pacific. I would like to first invite my own executive director, Rodelyn Marte, best known as RD Marte of APCASO, to share with us some lessons on COVID-19 responses from Asia Pacific civil society perspective. RD is a Filipino feminist activist with a passion for human rights, sexual rights, and social justice issues. RD currently serves as the executive director of APCASO, an Asia Pacific regional network working towards just and inclusive societies that respect, fulfill, and advance the rights of communities most in need. Over to you, RD. So, yep. And
hi, thanks, Jen.
Please do try to stay within your allotted time. Otherwise, I will have to be Ru or Peter.
Yeah, I speak very fast, so I'll drive the interpreters crazy, but I'll go fast. So thanks, John, and hello, Peter. And thanks to the organizers, co-organizers of this event, and to the fellow panelists and friends amongst the audience. I wouldn't take time to introduce APCASO because, as Jen has included that as part of my introduction. But aside from those information about our network, just to let people know that APCASO, aside from being a regional civil society organization network in itself, we also host the Global Fund Advocates Network Asia Pacific, and we are also the programmatic host of the Activist Coalition on TB Asia Pacific and the Global Fund's Community Rights and Gender Platform for Communication and Coordination for the Asia Pacific region. Jen, can I just check? I was expecting that my PowerPoint is going to be presented from the side of the organizers. Is it being flashed now?
Rachel?
You can share it.
Apologies.
Anyway, I would proceed. If the presentation is still catching up, Rich or whoever is projecting, I'm on the second page. I only have 4 pages. Just to share that the perspectives that I'll be sharing on lessons on COVID-19 responses from the Asia Pacific region, from the perspective of communities and civil society, is actually informed by 3 things that we've implemented in the last year. First is the outcome of the rapid assessment that we did as APCASO together with Gfan Asia Pacific on key and emerging issues of HIV, TB, and malaria affected communities and civil society during the COVID-19 pandemic. We could share with you the link to that, or you could go to APCASO's webpage to be able to access the full report. Also to inform everybody that the points in my sharing today is also coming from our insights that we've learned as we implemented support to communities and civil societies in the region to engage in the Global Fund's C19 response mechanism funding request development. So we did receive funding support from the Global Fund, particularly from the Community Rights and Gender Strategic Initiative, to mobilize our country partners in various ways through webinars, info materials, financial support, so they could do their own processes within the country to make sure that in the development of the COVID-19 response mechanism request, the perspectives and the realities of the most vulnerable and members of the key population are included, that there's meaningful engagement in the processes. So this process we were able to support in 10 countries in the region, including Vietnam, Cambodia, Pakistan, Indonesia, Bhutan, India, Laos, PDR, and Malaysia, plus TB-specific consultations in Vietnam, PNG, Pakistan, Nepal, Indonesia, India, and Bhutan. And then lastly, also to inform everybody, and also an invitation in the launch that we will be doing in our commemoration of UHC Day on December 10. This is some of the perspectives that I'll be sharing is also coming from the APCASO Asia Pacific Regional Report on Community and Civil Society Perspectives on Universal Health Coverage. That covers several countries, including Bhutan, Cambodia, India, Japan, Laos, PDR, Nepal, Pakistan, and Vietnam. Okay, so just to say that there have been a number of processes, mainly deriving from the of our community and civil society partners in the countries, where we try to distill lessons to share in platforms like this, as well as with the Global Fund. Next slide. And I'm jumping straight into lessons. What are the stories on the ground telling us? The stories from our country partners, from our community partners. Three main things, and then there's key lessons and key takeaways. One is that the pandemic, as we all know, it really just highlights many of the weaknesses and inequities of health system. Second, it is unfair, it is unjust, but it is what we have seen happening, and this is like the poorest and the most marginalized are the least likely to be able to easily access essential services during COVID-19, either for HIV, TB, or malaria, or even general health services. And the reasons for their difficulty in accessing is the same reasons that they are vulnerable in the first place. Thirdly, the COVID-19 pandemic has also demonstrated, however, despite the challenges, despite showing that the impact of COVID-19 hits the poorest and the most marginalized in the first place, it also shows stories and demonstrates further evidence, not that we need any further evidence, but the potential for community and civil society to step up and self-organize to support and fill critical gaps in services that should be mainly covered by the government. What do I mean by all of this? The pandemic highlighted many weaknesses of inequities of health systems. This is from the lack of preparedness, inefficiency in the supply chains, to providing adequate personal protective equipment for health workers, to the way that testing has been provided and vaccines have been rolled out. The COVID pandemic has had three direct impacts on people's access to healthcare in our region, which I think would be similar and also resonate with the other regions. Firstly, it resulted in the diversion of resources away from some health services towards COVID-19 testing and treatment. So we see a lot of resources for HIV, TB, and malaria actually diverted to COVID-19, which was treated as an emergency, testing and treatment, and more recently, vaccinations. In all countries that was part of our UHC report, health staff were removed from their usual posts, including primary healthcare facilities, to work in COVID-19 centers. Secondly, due to travel restrictions, reduced services or orders not to seek care for non-COVID related issues. So if it's not COVID-19, there was the prioritization in many contexts and discouragement from seeking healthcare. So many people's treatment was interrupted, including antenatal care, kidney dialysis, access to retroviral treatment, testing services for TB and for HIV. Methadone treatment was also suspended and many non-emergency medical issues were delayed, particularly from the discussions that we've had and heard in Vietnam and Japan, where we have seen temporarily closures of HIV testing in public health facilities. Some vulnerable and marginalized communities observed that they were not always prioritized for COVID-19 resources. So there was overt or covert discrimination against key populations in the access to COVID-19 testing and vaccinations. But in other countries, like for example, Cambodia, the reasons for this were more understood in terms of prioritizing healthcare workers, the elderly, the immunocompromised, or those living in urban areas with higher transmission. The indirect impact of COVID, there was direct, but there was also indirect impact of COVID-19. And this was just as serious for many individuals, including members of key populations. The loss of work or usual sources of income, particularly and those dependent on daily living, decreased living standards, and many people were forced to choose between rent and food, which has created negative health outcomes. I think all of this that I'm saying is not surprising or not new to a lot of us, but it just really drives down the point that in the pandemic, even before the pandemic, there were already a lot of inequities and injustices. The pandemic just catalyzes and crystallizes these inequities even further. And therefore, that's the last point in this page that I have right now. When we are talking about COVID-19 responses and making sure that the most vulnerable and the most marginalized are not even pushed further in the margins or discriminated against in responses, or their human rights are further violated, what we are seeing is during COVID-19 or pandemic situations, the abilities of countries to respond to reach the most vulnerable and marginalized is a reflection of how they have been effectively or not effectively doing this before the pandemic. And I'll just go to my last slide because I'm very, very sorry, conscious of the time.
You have 30 seconds. Sorry,
sure.
Artie.
Yeah, the only, if there's any one point that I want to leave in this session that I have is that, especially for the Global Fund, but even beyond the Global Fund, what we mean, what we want to see and what we want to drive is that investments in community system strengthening, if we want countries that have resilient and sustainable systems of health, there's no way for us to reach that without investments in CSS, in community mobilization, in community-led service delivery, in community capacity building, advocacy, community-led monitoring. Because the same, for example, the same communities that the Global Fund has invested in to be strong and to mobilize for HIV, TB, and malaria are the same communities that we have seen respond to reach their peers and to reach the most marginalized and the most affected communities during the COVID-19 pandemic. So investments in HIV, TB, and malaria CSS goes beyond the three diseases and is helpful for longer term and broader scenario health systems. That's all. Thanks, Jen. Thank you.
Thanks, Artie. And thanks for raising the critical points about the need to strengthen community systems. And I think the pandemic just really highlighted the critical need of investing in community. Without further ado, let me move on to our next speaker, Harry Prabowo from the Asia Pacific Network of People Living with HIV, based here in Bangkok, Thailand as well. Prior to join APM Plus, Harry worked at the Indonesian Network of Gay Men Transgender and other MSM network, WARIA and GWL INA as National Program Manager. He also worked as the director of a small program community-based organization that carry out outreach work amongst gay men and MSM in Jakarta and Indonesia. prior to join the regional network of living, people living with HIV. Harry, let me turn the floor over to you. You have 6 minutes, and please kindly keep to the time. Thank you, Harry. Over to you.
Thanks, Jen. I would like to share my screen. Okay, so 2021 marked the 40th year since the first cases of AIDS were reported. In this year, the global AIDS strategy is adopted, aimed to reduce inequality that underpins stigma and discrimination, and HIV-related criminalization that still drive the AIDS epidemic, which enhance people with vulnerability to acquire HIV and make people living with HIV more likely to die of AIDS-related illness. And soon after, a political declaration on HIV/AIDS is also being adopted, where member states express their deep concern about stigma, discrimination, violence, restrictive and discriminatory laws and practices that targeted people living with, at risk of, and affected by HIV. The inequality causes key population become the subject of stigma and discrimination, violence and punitive legal and social environments that has been proven by the UNAIDS special analysis this year, where key population make up around 65% new infection worldwide. Since the inequality is still underpinning the stigma and discrimination, and it's also embedding in law and policies, it will always create harms to the community in aggravating the HIV response and obstruct the community from acquiring information and access to health services. There are still more community out there is not able to access the breakthrough in the medical advance that can provide a life-saving for people living with HIV, where now HIV is become manageable chronic illness. When the HIV virus in our body suppressed to undetected level, it will be not transmitted to others. Hence, this medical advance can also prevent the community to acquiring HIV. And in relation to COVID-19, with the medical advance on vaccine that widely available, it can help boost the immunity and reduce the risk of death from the COVID-19 virus. But when we want to access those entire amazing medical advances, we want to access it without any fear of being recognized of who we are, disclose our HIV status openly, discrimination against and judged, or let alone being arrested. Therefore, a strong, concentrated effort is needed to dismantle this issue that put women and girls, gay men and other men who have sex with men, sex workers, transgender people, people who use drugs, prisoners and migrants at the greater risk to become infected with HIV and COVID-19. When we talk about the implication of inequality in Asia-Pacific regions, 37 countries criminalize sex work. 11 countries have compulsory detention center for people who use drugs, and 15 countries have death penalty for drugs-related offenses, where the situation has had the downfall of the harm reduction program in the region. 16 countries criminalize same-sex relation. 10 countries, transgender people are still criminalized due to their gender identity and or expression. And 31 countries where young people under the age of 18 still need parental consent to accessing HIV testing and treatment. But despite all that, there are some hopes. In India and the Philippines, they have successfully introduced the comprehensive HIV legislation. In Pakistan, transgender people may now able to express their gender identity and reflect to their legal identity. Just recently, Indonesia, transgender people now in the country is finally able to have their national identification card, where now they can access any government support, including the social security. In New Zealand and part of Australia, sex work decriminalized. In China, the country had abolished highly punitive compulsory detention for sex workers. In Fiji, Myanmar, Papua New Guinea are mounting calls for legal reform towards sex workers. And in Taiwan, same-sex marriage is legal, and this made Taiwan the first country in Asia Pacific to legalize the same-sex marriage. Now, please do take a look at us. We, the community, are more than our HIV status. We are more than any labels that denies our inherent complexity, since we are all individuals with multiple identities, interests, passion, and dreams. But let rest assured that we also can be partnership with stakeholders across all levels in government to fight barriers that exist in the AIDS response and the pandemics. So believe in us. Help us to strengthen our system so we become more resilient community. Trust us that we are capable to work with you to fight all barriers that still exist, including the inequality. And we will ensure you, we the community, including the people living with HIV and key population, especially in the Asia Pacific region, will continue our leadership to reaching the AIDS-related target and end the pandemic. But in order to ensure all of that to be happening, we do need a sustainable financing. Having said that, it is very important for the Global Fund to continue to support the Asia Pacific regions, especially in the context of post-COVID-19 pandemic. Together, we can age by 2030 and end the pandemics, and we will leave behind the 10-10-10. Despite the hardship that we currently face due to COVID-19 pandemic, I hope the support for the community shall be continued until all AIDS-related target is achieved, and we can also end the pandemic. Thank you. Back to you, Jen.
Thank you so much, Harry, and thanks for the powerful message, especially the resilience of community despite all the challenges and difficulties that communities, and especially the vulnerable populations, have been facing over the years, and the progress that's been made, but more needs to be made as well going forward. Let me then move on to our third speaker, who is also one of my personal idols, Dr. Oanh, or simply known as Oanh. Oanh is currently the executive director of the Center for Supporting Community Development Initiative, SCDI, in Vietnam, which focuses on community empowerment and creating enabling environments for the most marginalized and vulnerable populations, such as sex workers, drug users, people living with HIV, their spouses and children, poor migrants, ethnic minorities, and LGBTQI+ people. She will speak with us about communities' responses to COVID-19 in Vietnam. And there's been some really impressive and really inspiring work that's happened over the last 18+ months. So without further ado, let me turn the floor over to Oanh. Over to Oanh.
Thank you, Jen, and good morning, good afternoon, everyone. Let me share with you a story that I have witnessed of the couple, of the two people that will, I think the story of this couple capture the best how the Global Fund investment have impacted people's life and has impacted the community in Vietnam. So this photo was taken 7 years ago. It is a wedding of the two people that I want to tell the story about. The man's name is Tâm, his son, and the woman's name is Tâm. Both of them was drug user. They've been to the drug rehabilitation, compulsory rehabilitation center for many years. Both of them was in prison at some point. Both of them had TB, tuberculosis. Son had TB for 3 times, and Tâm got TB 1 time. Both of them HIV positive. So 20 years ago, before the Global Fund invests in Vietnam, we would not expect to see them getting older. We would not expect to see them getting married and have a happy life. But here they are, 7 years ago, in a community event, they got married. And they became, as they participate in the different HIV and TB program, they became the community leader, working on TB, on HIV, but also mobilize community and champion universal health coverage in their own community. They work with sex workers, with people who use drugs, with people who are vulnerable to TB, but also helping the homeless, the marginalized people, the other people living with HIV, the poor migrant. Now they became, like Son become the chair of the Vietnam Community Network for TB response. Has been very active in helping women living with HIV, women who use drugs, sex workers, and their family. And now their daughter, her nickname is Bong, mean little goby, the small little beautiful fish. Now start the grade 1 last September. So you wouldn't expect a drug addict, as some people would call them, and living with HIV, been to prison, to have a family, to have a healthy, normal kid that go to school as any other kid. So you can see the miracle of the investment in key population and in community. So when the COVID-19 came into our country, until 4 months ago, our response was lockdown. So quarantine and lockdown, strict lockdown. You can see in the street that usually very, very busy of Vietnam become deserted. There's nobody, there's even razor bar to lock the neighborhood that have a COVID case. And during this very strict lockdown, people was afraid not to go out, or people was not even allowed to go out of their house. But it's the community people, letting by the people like a Tâm and Son that went out on the street during the lockdown to distribute food, to distribute masks, hand sanitizer to the people who need the most. So in this photo, you can see Tâm and Son organize their group. They are the leader of a group of people living with HIV and drug user to distribute food to the people who are most in need. They have to wear the protective gown in order to allow to go into some of the area. And they were skillful enough to be able to work with the local authority that they are allowed to go into some of the quarantine areas that they can provide as simple as egg and noodle and rice to people, but also medication like the ARV, or to help people to continue their methadone treatment or the TB treatment. And even the Bong, the little goby, their daughter, is now helping other children. The 2 children that you see in the picture are the 2 children of a methadone patient. He's on methadone, and his wife, their mother, is in prison at the moment. He didn't have money to pay for methadone, and he was almost like taken out of methadone because they couldn't pay. But the Global Fund helped to pay for their fee, and people like Son and Tâm was helping those people to access to the Global Fund support during the COVID lockdown so that he can continue the treatment. And Tâm and Son also help them to have the father to have access to some livelihood support so that he can do small business, that he can maintain the life of his family with these 2 children. And the little Gobi, the daughter of Tâm and Son, are now sharing her books, sharing her clothes. The dress that the little girl is wearing is actually from their daughter, and toys and candy, and bring joy and support to these little children. So we can see that in my 20 years of seeing the Global Fund in my country, I would say I am an eyewitness of the Global Fund in my own country. I can say that the Global Fund investment on the most vulnerable population really saved lives. People like Tâm and Son, their life are saved by the investment of the Global Fund, but many other people life has been saved. The Global Fund help to protect human rights, help to promote the solidarity. Our society become a better place because people take care of each other. Stigma has reduced, discrimination has been reduced, and the social inclusion of the most marginalized and vulnerable people, like people who use drugs or people living with HIV, sex worker and MSM and transgender people are now more included in the society. Of course,
I'm sorry
far
to
from the
interrupt.
ideal situation, but we are almost there. So investment in the community system strengthening pay off for not only for HIV, TB, malaria, but also for universal health coverage, COVID response, and sustainable development goal. And this return in investment lasts even to the next generations, as you see. So that's the end of my presentation. Thank you.
Great. Thank you so much, Oanh. I'm really sorry to have to interrupt you earlier, but again, the stories that you share, they're always so inspirational, and they really provide a lens into, you know, the real impact and give a real example of how these investments have really changed life and why these investments are so important, even more so in the current time that we're living through. So thanks for sharing Zone's story with her family as well. So I know I'm conscious of the time, and again, just to let all the presenters know that we are hoping that you'll be able to provide some last minute remark toward the end of the session. So you'll also have further opportunity to make further comment, 90 seconds. I'm going to be very strict going forward before we close. But let me move then into our panel discussion. With us today are Imasha Perera and Danielle Marguari, Alexander Freese, and Daxa Patel. Peter and I will jointly moderate this panel discussion. Peter, over to you first.
Yeah, thanks. Thanks again from my side as well for providing examples from the life of drug users. I worked for an NGO in prison as well in my career, and I know how difficult and how heartbreaking the situation sometimes is. And yeah, from a humanitarian point of view, I really like that quote, so thanks so much. But I hand over now to Imasha Perera. So we slipped slightly. We have a discussion with representatives of communities that we did not hear that much about. So Imasha, you are the key population coordinator of the National Transgender Network in Sri Lanka. You are as well a member of the Global Fund's country coordination mechanism, representing key populations. And over the last 5 years, you have been engaged in the HIV response in your country, and you played a very active role in the development of the trans protection bill in Sri Lanka. And you will have soon a diploma as a fashion designer, which is congrats for that. So my question to you, we did hear a lot, Harry and RD mentioned that about community system strengthening, how important that is. And my question to you is, as a very engaged trans woman, what are your expectations towards countries, in particular in terms of championship and in reference to human rights principles and the meaningful involvement of civil society? What are your expectations? Please.
Hi, good morning, everyone. Thank you for the opportunity. There has been a lot of factors that contributed to me being here today. As a young trans woman from Sri Lanka, talking about communities and the role of donors in the HIV response, one of the factors is donors. The investments that were channeled through the institutions like the Global Fund to Sri Lanka turned a new page in the HIV response in the country by pushing us to recognize who is key, most at risk and vulnerable to HIV and enable and facilitate policies and processes. Practices and standards to ensure we are at the center of the response. The investments from donors-made organizations like National Transgender Network, Sri Lanka, a reality, and someone like me is possibility. Yet, we are not even halfway in the fight against HIV as an epidemic. We haven't achieved 90-90-90 target recently. As most of us know, COVID-19 was a hard hit on the one heart in shown how fragile our health systems are and how strong our community systems are despite the Pacific. Sri Lanka is being the 90-90-90 targets. We still continue to have laws and policies that criminalize the key populations, and we have significant financing gaps, especially for community rights and gender interventions and community systems, strengthening within the HIV response. This is why we need donors like Germany to continue investments and such things. And currently we are working on the Sri Lankan protection bill.
May I ask you something further? Because at UNAIDS board meetings and sometimes at Global Fund as well, we have discussions on who are the key populations. And we have countries that would or start to design their key populations a la carte, or the most vulnerable populations. So is it agreed upon that transgender are one of the key populations in your country?
Yes, yes.
Okay, then I think we continue the discussion, and I would hand over to Jennifer now.
Great, thanks Peter, and thanks Imasha for sharing that. Let me then introduce our next panelist, Daniel Marguari, who is the Executive Director of Spiritia Foundation in Jakarta, Indonesia. Daniel is also a longtime friend and a really inspirational leader in the work that's happened in Indonesia. Under his leadership, Spiritia Foundation works closely to support networks of people living with HIV and key populations, including people who use drugs, sex workers, transgenders, and men who have sex with men throughout Indonesia. And I think what's really worth noting also is that Spiritia is also a principal recipient of the Global Fund grant in Indonesia, and being that a lot of the Global Fund grant PR in most countries are usually under government ministries. This is, there are a lot of really lessons that could be learned, but also it's quite encouraging for other civil society organizations throughout the region to strive for. So Daniel, let me ask you the question that we've been thinking about. You know, Indonesia is one of the largest recipients of the Global Fund in our region in Asia Pacific for all three diseases. And as a civil society principal recipient under the dual track financing policy of the Global Fund, working with and for communities of key populations, could you share with us the most important lessons resulting from Indonesia's COVID-19 response that impacted the key populations? And also, what are your expectations? And I think, you know, after these last 2 years, from donor countries such as Germany, who are part of the G20, and as a platform that can do much, much more on ensuring sustainable financing for global health, including the communicable diseases such as HIV, TB, and malaria. And given that Indonesia will be hosting G20 in 2022, any thoughts and any expectation that you could share would be much appreciated. Over to you, Daniel.
Yeah, thank you so much, Jen. Yes, Indonesia managed the source of the Global funds of around, I think around 700 million USD from 2016 until the plan 2023 for AIDS, TB, and malaria program, which right now has been hampered in Indonesia since early 2020 because of COVID situation. Indonesia has experienced an increase and seriously in COVID cases at least 2 times, and restriction have been imposed since March 2020. COVID cases continue to rise until the peak occurred in the middle of 2021. Right now, it's manageable for Indonesia the last 3 months. The Spiritia Foundation, as my organization, as one of the, yes, right, as one of the Global Fund principal recipient, our organization managed around 80 million USD for 2016 until the plan is 2023 period for HIV and TB HIV program in Indonesia under dual track financing. It sounds how important the dual track financing is to be prioritized and democratic and transparent process in identifying civil society as a PR. It's not only for Indonesia, it should be in many countries. In the COVID situation in the last 2 years, Spiritia Foundation has made many changes to its programs and activities from physical then to be virtual. Almost all activities are constrained and cannot be carried out optimally. That's our implication, honestly. We have to prepare many works to change from physical to virtual. It's very difficult works actually. Almost everything is done via virtual only for many months. We have been facing that one. It's very disturbing, but we have no choice because we have to adapt to the current situation until right now. We must not stop reaching and supporting at-risk population, also the PLHIVs in the COVID situation. It should be continued. We need to continue to educate them, to support, to access them to health services, both for testing and antiretroviral therapy. There are hundreds of thousands of people who need our support every year. When services are overwhelmed for many months and focus on dealing with COVID, it's very difficult time. We also must seek and access to vaccine actually. You know, when we have been working for COVID to implement our program, the HIV communities worker also, we working so hard to accessing them with the vaccine, including the beneficiaries also, the key population, the PLHIVs, our beneficiaries, because more and more people are infected and a few of them are not helped and die. And you know, its mental health issues are increased among beneficiaries. HIV healthcare workers and communities workers also, it's very, very difficult. Many beneficiaries who were laid off from their job or business quit and have no income anymore. You know, for 2021 case finding decreased significantly because we cannot implement the programs related to HIV. Need to refer and start on ART at 2021, it fell significantly. My expectation from the donor countries such as Germany, the problem of COVID has made many developing and poor countries pay huge costs to deal with COVID. And this is not over yet. Health costs are increasing in Indonesia. It increased a very big number, and many countries also, I believe, but focus on COVID. And it has implicating in reducing other health costs, including AIDS, TB, malaria, to deal with COVID. So finally, so many diseases budget, it should be reduced because we have country put a priorities for COVID. This shows that many other health programs are disrupted and need support, including AIDS, TB, malaria, especially programs managed by community organizations. For this reason, we encourage Germany, Germany government and Germany as overall to continue financing support to global health, especially for AIDS, TB, and malaria. Also through the Global Fund in 7 replenishment, it will coming next year. We encourage Germany and also Indonesia. Yes, Indonesia has a G20 presidency to influence and advocate for other donor countries. That's a good moment. Then to continue to support AIDS, TB, malaria funding. We also encourage Germany to continue the implementation of debt to health. Depth to Health approach is a good success, as was done to Indonesia through the Global Fund mechanism before. The last is importance of equitable access to commodities and the important role of the Germany as a global health champion in showing the leadership. Thanks, Jen.
Thanks, Daniel, and really thanks for raising the point about equitable access. But your comments and your reflection also reminded me of a recent consultation that we carry out APCASO and with UHC 2030 CSAM, the civil society engagement mechanism. In one of the participants basically a very simple sentence of saying either you pay or you die. Right. And that's exactly the situation that we're facing. And before in HIV, but now that COVID has really exacerbated the vulnerability that many of these communities face when it comes to access to equitable health. So thank you for those really powerful messages. Let me then return the floor back to Peter to introduce the next panelist. Peter, over to you.
Yeah, thank you. And Daniel, thanks so much for your input. I introduced Daxa Patel now. And Daxa, you're an openly living HIV activist in Surat. Surat is a city in the state of Gujarat in India. You are the president of the National Coalition of People Living with HIV in India and a founding member of the Indian Working Group on Health Advocacy. Daxa, or Daxa, my pronunciation might not be perfect, but as a person diagnosed with HIV in 1997, you developed partnerships in your city to secure free access to services, to prevention, to hospital beds, to HIV medication, and to nutritional support for children and widows living with HIV. I just wonder how your services were challenged with the COVID-19 pandemic. But my question to you is, with your background as an activist and as a person openly living with HIV, and I have really pointed out, I think it's quite difficult in India in a society that is probably I've been there a couple of times, not that open to talk on HIV status. I think this needs some encouragement. What can, in your perspective, donors such as Germany do to support implementing countries such as India in its health response? So what can we do, and to what extent can we or can Germany provide support? Daxa, the floor is yours. Thanks so much for being with us. So Daxa is done out. I hope my question was not too challenging. Daxa, probably you come back.
I think Daxa was in her car.
Yes.
And she had, yeah.
Yes, I came back.
Okay. Okay. We can hear you.
My car. That's why it is. Sorry. Yeah. Thank you so much. So shall I?
Now it's better. Yes. Yes. So better stop now with your car, but please not in the middle of the street. Yeah. Go ahead.
Yeah. So thank you. First, Jenny and Gfan for this opportunity. Actually, in India, when the COVID-19 crisis was happened and entire country was locked down in all of a sudden at midnight, it was a lockdown. So it was a big challenge for all citizens of India, including community members who are living with HIV, KPs. So all are stuck in where they were, was in a country, any city or any village level. In initial level, as a preparatory action, we immediately started a dialogue with our National AIDS Control Organization, State AIDS Control Society, and we started war room for support to our community member for ensure uninterrupted ART medicine supply, because it was a hard time to access the treatment for anyone individual who are in very rural or even they are in city, because there was no transport, everything was stopped in an immediate level. And we first dialogue to allow multi-month dispensation, and we are very, our advocacy was very successful. NACO was allowed and approved for multi-month dispensation from for any one community member from a river center. So that was a very good support system was initiated. And the second part, we stepped up one more action with the dialogue with a National AIDS Control Society for a pickup from like district level, our network office, supply through like buddy system, home delivery, if the person is willing to come to the main center or nearby center, because there was many children, orphan children and women, even key population was there who don't had any availability of transport to access the medicine. It was a funny thing, but it was true that we used like milk van, vegetable van transport for ART medicine, because it was a huge parcels of medicines, and it was very hard to reach out village area or any northern and northeast side in a village and hilly station. We sensitize a lot with the police, even local sarpanch at village level to access of PLHIV travel support by like we having one green book system for anyone individual who are enrolled in ART center. So based on that green book, they will travel to nearby setup to access the medicine. So this is the way we started accessing of ART medicine for community member. Same time, there was a dolutegravir medicine was introduced in a country, and there was a huge counseling and understanding gap of changing of medicine combination, color, or so many things. So to educate community members for treatment literacy and treatment preparedness, so we initiated dialogue by webinar. Around 257 virtual webinars we conducted. We reached out around 68,000 plus PLHIV members for clarity about medicine and self-care, prevention, and prevention measures for COVID-19, how they will become more safe from COVID. So this is the big initiation of a community member. And I'm personally sharing my own experience here that I never ever used Zoom platform, and it was a learning for me also to how to utilize that such a virtual platform.
Thank you, Daxa, for
so
sharing your. Sorry, I have to cut here because the time is running out, and we have some further questions. So sorry for so much for, but thanks for sharing your story and how you sort of enabled yourself to get treatment to the people. I think this is quite innovative, and this was interesting to look at. And thanks so much. I hand over to Jennifer again, and please, sorry for that I cut you, but we have, the time is certainly limited. Yeah, thank you.
Thanks, Peter, and thanks, Daxa. Our last question, and I think it's it's the most challenging one, and I'm requesting Alexander Freese to take 5 minutes to really respond to it before we move to our closing. So Alexander is a senior policy officer in the Global Health, Politics and Financing Division at the German Federal Ministry of Economic Cooperation and Development. with an academic background as an economist. He previously worked at GIZ, the United Nations Development Operation Coordination Office, and Seek Development. So, Alexander, given that I think a number of speakers had spoke about, the need for funding toward community and investing in countries to support infrastructure building as well. Given that Germany is the 4th largest public donor to the Global Fund and has been a major supporter of it since its founding 20 years ago, and has contributed a total of 3.82 billion euro to date. For 2020 to 2022, Germany has pledged 1.29 billion euro, which includes a 150 million euro contribution to the Global Fund's COVID-19 response. So if you could you please tell us, what do you feel is needed to involve communities and civil society even more meaningfully in Global Fund funded programs? And what can donors such as Germany do more and better off learning from the COVID-19 pandemic and global health? Over to you. Thanks.
Thank you, Jennifer, and thank you, Peter, also for having me. It's really a pleasure to be here, and actually I'm quite a bit humbled to share, this panel with so many really distinguished community leaders and really inspiring inputs. And that's also actually why I was so interested in joining this panel, also because it's really good to hear how communities experience COVID-19 and also the responses. Obviously, the impact of COVID-19 on communities was severe. I mean, we see that from the numbers. HIV testing interrupted, services interrupted. And really, I think today also has shown that the response by communities is really critical. And to maintain services through what was just mentioned, through remote counseling, to the provision of medicines, and providing support to each other. So it's really, really important. And yeah, maybe just to mention, because I was just really kind of also positively impressed again. I mean, I read about it, but I think Harry was showing a few changes also in the policies, laws and regulations, and it's really sort of, good to see this progress. Of course, now, when it comes to fighting HIV/AIDS, I mean, COVID-19 will definitely be a setback. So we need to continue to provide funding and to obviously not lose focus, sort of not having COVID-19 take up all the space, but, remember that there are other pandemics that take a lot of lives and they are preventable or treatable. Maybe since you mentioned the Global Fund strategy, I think the new strategy of the Global Fund that we shaped as members of the board and also the strategy committee, I think we're quite happy with it. I mean, you all know that communities take a much more central role in the strategy. I mean, they are sort of mentioned up front, and they even have their own sort of objective. And really, if you read the small script, I mean, I think it really could be a game changer for how the Global Fund works. Obviously, it's now on the implementation and how this actually plays out in the Global Fund programs in the next cycle. I mean, that is to be further discussed next year. So we will be on the ball and shape this strategy implementation. But I think, focus on HIV prevention, differentiated HIV treatment services, people-centeredness, and this community-led programming and also monitoring. I think it's quite remarkable. Of course, it's also still a partnership. I mean, governments play a big role. I think it was also mentioned today, and I think there was also good discussion in the Global Fund board on sort of this, working together. And I think in Germany, we have a lot of experience with that as well. Sort of the different levels working with each other, with the federal state. I mean, sort of having central government response, but then also relying on a lot of civil society partners and local communities to do the work. And I think in COVID-19 response, this has been shown even stronger. Maybe since we have so little time, I mean, so that was maybe on on the Global Fund strategy. So what do we need to do? I mean, Germany did a lot. We actually invested.
Alexander, sorry, can you do it in 30 seconds? And that would be your final remark.
Yeah.
Thank you.
Maybe just 3 points on what I think Germany can do. I mean, we did already invest a lot in Act A, in our COVID response, in the Global Fund and the C19RM. Actually, we provided 290 million euros for this COVID-19 response mechanism. But I think it's so following a human rights-based approach, leaving no one behind. I mean, the German government has issued a LGBTQI inclusion guidelines that guide our work. That's important to just be engaged. Secondly, to continue to support the Global Fund with the replenishment next year. The Act A, I mean, the pandemic is not over. We still need to work on it. COVAX, vaccine, so solidarity globally. But then thirdly, maybe very briefly, also, we need to continue to focus long-term also on health system strengthening, on social protection. One Health approaches are one of our guiding principles, I think. So we also need to make sure that we it's a lot of used term, but build back better and make sure that, health systems are strong and resilient. I think it was mentioned also, basically strong health systems are the best pandemic preparedness, and we need to continue to focus on that. So thanks. I tried to be really
Thank
brief.
you so much.
Thank you.
Really appreciate it. And for those really valuable recommendations as well. So I'm conscious of time, but I do want to circle back to each of the presenters and panelists for 20 seconds to 30 seconds of last comment remarks. If you would like to share based on the discussion today, what are some of your thoughts and reactions? So I'm going to go back up and then ending with our very first speaker, RD. So back to Daxa, 20, 30 seconds of last comments that you would like to share. Over to you, Daxa.
Thank you, Jenny. My last comment is about country like Germany invest in network building and advocacy, as most of the Global Fund funding is going in is a service delivery part. So this is my last comment.
Thank you so much. Daniel?
Yeah, as Indonesia position in the presidency G20, for me, it's very important the role of to influencing and advocacy the donors countries to continue to put global health as a priorities, especially STB malaria, to support 7 replenishment. It will coming. So this year, our president just signed the presidential regulation on TB as a specific and country priorities. So we need to continue with AIDS and malaria then. So we need to continue to emphasize how important the DRM, the domestic resources mobilization. But during COVID situation, many countries have serious implication and need donor countries to continue. Yes, thank you so much.
Daniel. Imasha, your key message, last words.
This is why we need donors like Germany to continue investing in HIV response across the world. This is why we want donors like Germany to keep championing the HIV response, the human rights response, the gender response, the response for the key populations. For women and girls, for vulnerable populations, we want donors like Germany to recognize the cultural, crucial roles played by the communities and invest directly in community systems and the upcoming Global Fund 7th replenishment in another opportunity for the donors.
Thank you so much for that. Oanh?
I am very happy to hear from Alexander that Germany will continue to support the 7th replenishment of the Global Fund. And I fully agree that we need to invest in the strong health system. But I also would like to recommend that in addition to the health system strengthening, we need to invest in community system strengthening as well. That will last, and it will provide the foundation for human rights advocacy and gender work, and also as for community-led intervention. Thank you.
Thank you, Oanh. Harry?
Okay, thank you, Jen. So my key takeaways, like, I think we have to see the community. We should stop seeing community differently, because we should be partnership with them. So I think hopefully the partnership between a bigger developed country and developing country, although those government with the community should be continued if we want to achieve all targets, all global targets and goals. Thanks, Jen.
Thank you, Harry. And lastly, RD, 30 seconds. I know you can do it.
Yeah, I just like to call on everybody to support Gfan AP's The Power of More campaign, particularly German government, but as well as other donors and as well as community and civil society partners. So more power, but at the same time, more funding for the Global Fund. Thanks, everybody.
Thanks, Ardi. And I do want to also give Rachel 30 seconds to give us a quick closing remark as well before we officially close the session. And also apologies for skipping over Q&A session, but I also do not see any questions being left in the Q&A chat. So over to you, Rachel, 30 seconds. And you're on mute, Rachel.
Thank you so much. And you can visit www.gfanasiapacific.org for more information on our upcoming replenishment campaign for the 7th replenishment conference hosted by the United States. We want to thank Germany for all the work that you've put in so far and the commitment, the pledges that, to civil society and communities over the years. But we expect more. So we do look forward that in extraordinary times, there is the power of more, and we can do so much more better, and we can be better together. So we thank you again, Alexander, for championing our causes. Germany has always been a strong ally on the Global Fund board, alongside communities and civil society, and we hope that this can continue going forward as we go into the more tricky and substantive discussions around allocations and eligibility. So thank you again, Alexander, for your time.
Thank you. Thanks, Rachel.
And to all, keep safe. Thank you.
Yeah, before we...
Go ahead, Peter.
Yeah, thanks from my side to you. I think this was just a perfect decision to have this session together, because this does not happen that often, that you really give away a whole session to another part of the world. So thanks so much for sharing your stories with us and your quests, and thanks so much to Alexander for being with us. I think this was important and this was good. Before we close, I just would, we have a little break now, and we are going to continue at 1:20 Central European Time. So this is in 25 minutes. Please don't go away. Continue with us. The next session will be extremely interesting. It will be about the changing global health architecture that we currently experience and all the questions that go along with it. So thanks so much for being with us, and we have a break now.